Hello friends, welcome to the channel The Word of Ayurveda. In previous episodes, I was talking about the processing of the food or the act of digestion of the food at the level of mouth. Now we all know that sometime in the very functioning of the mouth, the problem occur so that food cannot be properly chewed or converted into the pulp for swallowing it. And as a result of it, there is problem with the digestion of such food in spite of the food being very compatible and of extreme requirement for our body. Now, the problem with the functioning of the mouth can occur due to various reasons. The first among them can be the absence of the denture or weak denture. Now, if the denture of the mouth is weak, the food will not be properly chewed. As a result, it cannot be converted into the pulp form. Now, the semi-chewed food, when taken into the stomach, will lead to the diseases of the stomach and diseases associated with poor digestion of the food. Similarly, if our gums are unhealthy, we are suffering from pyorrhea, or even our teeth are having infections, we can pass on that infection along with the food to the stomach, leading to disorders at the level of stomach. And these disorders can be of chronic nature if the infection to the gum and teeth are of chronic in nature. Similarly, if we are not having sufficient level of saliva, which in technical language we call as xerostomia, then again the food will not be converted into proper pulp, and the dry mouth syndrome is a very difficult problem as far as the digestion of food in the oral cavity is concerned. In very extreme old people, even the muscle of mastication may be very weak, so that the mastication cannot be done properly or forcefully. As a result, patient only carries very soft food or very selected food for intake, which may not be balanced as far as the nutrition of the individual is concerned. Sometimes the specific condition may arise when there is a facial palsy or the muscles of the face are paralyzed due to some particular disease, which again interfere in the chewing of the food, and food cannot be properly digested over there. Not only this, sometimes people develop ulcers over the mucosa of the mouth or inflammation of the tongue, so that they become very choosy about the food and they are deprived of the balanced food. At the same time, due to the ulcer and painful conditions in the mouth, again the food cannot be properly chewed, resulting into poor digestion further onward at the level of stomach. All these things can be taken care of if we regularly improve the oral hygiene. In fact, not only the oral hygiene, oral dental hygiene need to be improved or kept optimum, so that the food which we take is properly chewed, properly made into pulp, and given down the intestinal tract into the stomach for its digestion and absorption over there. Very simple problems are there, that when we take the food, it should have sufficient moisture in it. We should give sufficient time for the food to be chewed inside the mouth. That is, we should not take food when we are in hurry and food is not being properly chewed. Too hard food should not be eaten, so that it causes problems in the stomach. And similarly, continuous intake of pulpy foods, fluid diets also make the chewing process of the individuals weak. As far as maintaining of the health of the mouth is concerned, regular brushing of the teeth is concerned. This is the single most important as far as orodental hygiene is concerned. After every meal, proper mouthwash should be done, proper brushing of the teeth should be done. And for the health of the gums and teeth also, we can also go for a regular habit that after brushing, we take some oil in our mouth, retain it in our mouth for some time, then rinse our mouth with it, and then throw that oil out. This will not only smoothen the lining of the mouth, but this will also make our teeth and gums healthy. Similarly, if at all we are in the problem of repeated ulcers in the mouth, this also smells that our intestine is not working properly, and maybe the acidity or alkalinity of our mouth is extreme, which causes the oral ulcers again and again. We need to correct our food to suit our power of digestion, to avoid repeated mouth ulcers, and make the food nutritious with vitamins, and also to improve the oral health, to avoid this type of problem again and again. Certain liver supporting drugs like Arogyavardhanipati, like Kumariasav, and certain mild laxative like Trifla, like Abiarist can always help us in avoiding the oral ulcers which some people get again and again. At the same time, spicy food should not be taken by a person prone to get repeated oral ulcers. If at all these ulcers do not heal automatically after a few days, it is advisable that we should go to the physician to get them checked and get the treatment. Similarly, regular appointment with our dentist should be a habit so that we do not land up with the chronic and serious problem of our denture and gums. If we follow all the basic instructions, only then we can maintain the health and hygiene of our oral cavity. I hope this is sufficient for today. In next episode, we will talk about digestion at the level of stomach. This is sufficient for today. I will like to get your feedback on email of this channel, the Ayurveda Health Helpline at gmail.com. I will repeat it, Ayurveda Health Helpline at gmail.com. Thank you.